now to the Chief Scientific Officer for the wellness company, Dr. Peter McCullough. I have been chomping at the bit to ask you your take on this executive order we heard all about yesterday. Some are saying it's an absolute step in the right direction. You have some cautions. Tell us.
You know, I do think it is a step in the right direction. Now, as a cardiologist, about 90% of the drugs I prescribe are generic. So they're already low cost, and this executive order wouldn't apply to that. But the branded drugs right now are priced so high, and unfairly so for Americans.
Yes.
Because they're not priced so high in Canada, Europe, and other Western countries. And they're unfairly priced. There's so many prior authorizations and approvals needed. Many doctors like myself give up, and we never prescribe these drugs. So believe it or not, Trump is doing Big Pharma a favor by dropping the prices on these and putting caps on these. I'll be more likely to prescribe it. The insurance companies will be more likely to improve it, and the drug company revenues will increase at a much more fair price point.
Because part of this will eliminate some of the PBMs. You and I have talked about these PBMs before. What effect will that have? And is that why there's so much, it seems like, money coming out of nowhere with this EO?
Yeah, so all these intermediaries, the pharmacy benefit managers and authorization groups, what have you, they charge fees. And the pharmacies and the drug companies have to pay. Ultimately, the consumer pays. By eliminating all that and dropping the costs, I'm going to be more likely to prescribe one of these newer high-tech drugs at a much more reasonable price, and the patient's more likely to get it.
It is really exciting when you start to think about it. What else needs to be done, though, Dr. McCullough?
You know, we have a tremendous amount of work, I think, to get fraud and abuse and corruption out of the system. We know that, within the group purchasing organizations and hospital drug procurement, people, working close to health information technology, electronic medical records, all of these spaces are filled with corruption right now. And we need to have a sweep of corruption out, make sure the government is not entangled with private entities that are actually working against the health care of Americans. Yeah.
Well, there are so many things that you all have been doing at the Wellness Company for so long, since way before any of this was happening. How is this changing the products that you're offering to your customers? Patients.
We've been responsive to our customers, Dr. Gina. Patients want non-pharmaceutical solutions,
right,
to improving their metabolism, immune system, freedom of infections, having themselves feel better. Products that help with skin and hair, mood, certainly detoxification after SARS-CoV-2 infection and COVID-19 vaccination. So we are providing a non-pharmaceutical set of solutions. First, we plenty of doctors here to prescribe generic and branded medications, but at the Wellness Company, we are putting the patient first in this whole new era of Make America Healthy Again.
An ounce of prevention we always hear, and the Wellness Company certainly has some great, for example, cleanses that you can do. What do you recommend to people right now, where we are in seasons and all the things, the ominous news we're hearing out there? What do you recommend for people? What's the best product if they're going to invest today?
Yeah, many are seeking this combination product of ivermectin and mebendazole, which is used to treat parasitic infections. The CDC over 10 years ago, has a big push to recognize that there are neglected parasitic infections. The CDC calls them NPIs. We eat sushi. We can potentially eat undercooked beef and fish and other meats. In restaurants, we travel, and so parasitic infections can occur, and when they do, they're difficult to diagnose. So patients should stop in, see one of the doctors at the Wellness Company, and consider a parasite cleanse if it's clinically indicated.
President Trump recently banned gain-of-function research, something I know TWC has been pushing hard. Why is this so important?
It's like university labs could develop nuclear missiles. with no regulation. Think about this. These pandemic potential infections can get the whole world sick. So these labs are working on developing designer viruses, bacteria, and fungi to harm the world's population, and at the same time come up with a countermeasure like a vaccine or a therapeutic. It's far too risky. It was the right thing to do to shut it down. We need to get control over this, and we need to get control over it worldwide. 14 biosecurity level 4 labs in the United States, including one in Galveston, Texas, shut them down. Over 140 BSL-3 labs. Far too dangerous to have this work done in America, and I'm glad Trump took this bold step.
Dr. McCullough, just a real quick, no time left, but what grade would you give President Trump so far?
I give him a B+. I always want to see better.
Yeah. Dr. Peter McCullough, thank you so much.